Hello everyone. My name is Emily, and this is my final presentation for Social Work 7402. Um, Today, I will be focusing on my internship and some of the work that I've gotten to do at the Trauma Recovery Center at Ohio Health, specifically at Grant Hospital. So a little bit of background regarding my internship that I got to do this year is, like I said, I work at the Trauma Recovery Center. So what that means is that anytime someone is brought to Grant because of being a victim of a crime or having a fall or a car accident, any sort of like physical trauma that impacts the body. Part of my job is going in and doing a couple of screening questions and then drug and alcohol questionnaires as well as mental health and PTSD screeners. And then following that, we link them with what's called the Victims of Crime compensation, and that gives money back to people who lost wages or lost clothing or things related to that because of being a victim of a crime. Some of the crimes that we could see are like assaults, gunshot wounds, hit and run car accidents, as well as various other things. So yeah, that is part of my internship. And this year, I got to work alongside my supervisor and one other coworker at my internship to help create what we call a co-victims of crime grief program. This will be focusing on people who have lost someone because they were a victim of crime. So, say someone was shot and they ended up dying. We would then link with their family that we would link with their family to provide interventions and resources for them. And so this is what my project is based on this semester. So yeah, we'll go ahead and get started. Um, so the focus of this evaluation is among bereavement and grief in families who have lost loved ones due to violent victims of crime. And just like a disclaimer, this is different than like the hospital. They have like chaplains or people who come in when there is a death in the family, and you know, they help kind of with the immediate effects of grieving and death, and then this is more of a long-term case management based plan. Um, so some of the services we're looking to offer are case management, counseling referrals, food, shelter, um, and sometimes like loss of wages, like I talked about earlier. And the process that this will look like is identifying patients from Grant who have passed away. Usually we do this, we have a census of all of the people who are at Grant, and then you go through and identify those who have passed away. And then determine of those who have passed away who is a victim of a crime. And then clinicians will begin to reach out to those families afterwards. This program addresses the traumatic grief of losing a loved one to violent crime. This can be worsened, this grief can be worsened because of the violent, sudden nature of a crime, and can often lead to mental health issues like PTSD. Um, Homicide rates in the United States are higher than other countries that are developed. In 2020, over 24,000 homicides were reported. For every homicide victim, 7 to 10 people are significantly impacted. Um, and that is just like a general statistic. Obviously, we know that could be more or less. Um, some of the psychological things that can come from this are prolonged grief, depression, anxiety, just like overall stress of like having to pick up pieces of a sudden death can be really alarming for people. Um, It can disrupt family dynamics, community dynamics. Obviously, sometimes crime it can be gang-based or hate group-based, and so that obviously can disrupt the dynamics within cities and towns. It can contribute to social isolation, fear, trauma, and the stigma of a death that is violent or because of crime. It can lead to lack of support just because of judgment or, like we said, stigma. Continuing on, um, Black and Hispanic populations are more heavily affected, as we see the populations that are impacted by violent crime are very disproportionate. The African American homicide rate is 6 times higher than white Americans. Um, and lower income urban neighborhoods are more affected due to social inequalities, um, and fewer resources. And women bear the burden of caregiving while grieving, which I think is something that is not talked about a lot, how hard it is to continue on in our day-to-day life when we are processing through loss and grief. The focus of this program will be to support those who have lost loved ones due to violent crime. It'll provide long-term case management, assistance with food and shelter, counseling, referrals, address grief, PTSD, and recognizing disproportionate impact on communities. The goals are to assess the specific needs. So for some people, it might be food and shelter, but for other people, it might be um, needing counseling, or it might be finding a place to live for children or things like that. Um, Measure reductions in prolonged grief. So we want to decrease um, prolonged grief and PTSD symptoms through counseling. Improve family communication and coping skills. As we know, grieving can kind of unite people, but it can also tear people apart. And so we obviously want to focus on unity within families. Um, Inform program improvements, funding, um, and policy advocacy, conduct periodic assessments for ongoing data collection, emotional support, grief counseling, peer-led support groups. Some of the eligibility is focusing mostly on adults or completely on adults who are 18 and older and have lost a loved one due to violent crime. We'd still be able to provide resources for people who are under 18, but focusing on direct case management with adults. Um, Evidence-based approaches include trauma-informed care, complicated grief therapy, social support, and resilience theory, and focus on mental health outcomes. Challenges can be stigma, levels of engagement, levels of community-centered engagement. So evaluation, this evaluation is a program level evaluation, obviously since we're focusing directly at Grant Hospital. Um, and the Trauma Recovery Center at Ohio Health. This evaluation focuses on how well the program supports families who have lost loved ones due to crime, rather than assessing individual case outcomes. So we're not looking at just like one person, we're looking at the whole Trauma Recovery Center and the grief program. The goal is to determine whether the program meets the intended objectives, including reducing prolonged grief and PTSD, improving coping skills, and enhancing family communication. The evaluation will address the following research questions: impact of the TRC on participants' grief. What extent does the program improve coping skills and resilience, among others? How participants perceive the effectiveness and accessibility, and challenges or barriers that are faced in engaging with the program, and also how can we address those barriers to improve service. Overview: addressing needs of families who have lost relatives to violent crime. It's program level, as we talked about, and the goal is to develop an intervention program specifically for clients grieving a loved one due to violent crime. And the purpose is to assess and determine true needs, and how the TRC can best support them. Primary outcomes: reduce symptoms of prolonged grief. These can be emotional numbness, avoidance behaviors, intrusive thoughts, depressive symptoms is another one. Improve family communication and emotional support. Strengthen the relational health within families. Increase coping skills and resilience. Some of the key stakeholders would be the program administrators at the Trauma Recovery Center, and it is a grant-funded program, so those who are funding the grant. Um, and they would need to assess the program effectiveness, how we allocate the resources, as well as modifications to service. Um, Another key stakeholder is the clinicians and social workers who will actually be doing the work. They'll need to adapt and improve therapeutic interventions based on the data that's collected. Um, Policymakers and community leaders, they can use this evidence to create other programs, to increase funding, to really emphasize grief support. And then families and participants obviously will be hopefully greatly impacted in a positive way by helping to cope with grief skills. The timeline is more long term just because of the nature of grief. It is not set in stone for every case. Like some people, it's just a couple of months, and some people, it's years, and it just kind of depends on the process. Also, of when we determine that a client is deceased and when we start the actual intervention with their family. Um, the goal is to have periodic assessments to track interim progress. So this could be like an initial pre-program assessment that is like asking how they're coping with the grief, and then midway through the program, and then additionally like a conclusion of the program assessment to allow us to collect data and figure out where people are at. And this will be collected by the clinicians who are implementing the program. Requirements would be access to data collection tools, consent, secured platforms for confidential information, and collaboration with mental health institutions for data analysis. Challenges and strategies would be engaging grieving families will be difficult because, everyone handles their grief differently, and people may or may not want people involved in their grief. So it might be hard to engage people to start. Solutions could be flexible schedules, incentives, and remote access to evaluation surveys. Expected outcome is to gain a deeper understanding of how to practically support families with grief, and strengthen services within the Trauma Recovery Center to better meet the needs of those who are impacted by violent crime. A little bit about the evaluation design. It is mixed methods, which means it has a pre and post design combining quantitative and qualitative measures. It assesses the intervention effectiveness in reducing traumatic grief and improving coping. Measurement baseline and post-intervention changes in grief, PTSD symptoms, and coping skills. Inventory of complicated grief assessment, depression, anxiety, stress scales, and qualitative interviews are all measurements that could be used. Um, an example of like an intervention implementation would be like 8 weeks of grief counseling session weekly, and then 4 weeks of bi-weekly like coping mechanism workshops. Um, Post-intervention measurements would be retaking some of those scaling assessments. Um, Data analysis would be pre and post intervention data to assess changes in grief severity and mental health and coping mechanisms. The mixed methods approach ensures that both statistical analysis and personal narratives inform the program impact. The mixed methods, why, is because it captures both qualitative and quantitative data. This could be like personal experiences and symptom changes, and it enables an assessment of grief and mental health outcomes, and provides strong evidence for program improvement, as well as some of those like stakeholders we talked about, funding and policy advocacy. Okay, moving into visual design, like what practically it will look like. Some of the key things to think about will be recruitment. a lot of these participants will be referred directly from Grant Hospital and be placed into the Trauma Recovery Center outreach program. And then pre-intervention assessment, we'll take an inventory of grief, scales for depression and anxiety, as well as an interview about personal grief experience. Some of the interventions will be counseling sessions, coping workshops, peer support groups, as well as like individual sessions with a case manager to assess need for things like housing, shelter, food. Post-intervention assessment were more of those scales that we talked about in the qualitative interview, data analysis, pre and post intervention data assessments, and then population of interest is adults 18 plus in the Columbus area who have lost a loved one to homicide or violent crime in the past year. Referred through Grant Medical Center or community outreach efforts. We're targeting those with complicated grief and PTSD symptoms. We want to aim to be inclusive of socioeconomic status, racial and ethnic backgrounds, and those impacted by crime. Again, this just kind of goes over the community outreach via support groups and events. Grant often hosts workshops and get-togethers for trauma survivors. Materials could include pamphlets about eligibility and general knowledge about the program. Confidentiality measures will be used to build trust and reduce stigma. Flexible scheduling as well as telehealth options would hope to increase participation. Sampling selects participants who meet program criteria, ensures focus on individuals most likely to benefit from intervention, support meaningful data collection on grief and PTSD. Findings can be generalized to similar populations affected by violent loss. The measurement plan, reduction in grief and related symptoms, enhanced coping skills, increased social support, continued engagement. Again, we'll use some of those scales that we've discussed already, as well as a coping strategies questionnaire. Threats to validity. So this could be selection bias, which is like purposeful choosing or purposeful sampling that could lead to systemic differences between participants and non-participants. Severity of grief. It's really hard to measure the level of a grief of a person when they start the program. And so that could influence participation as well as like the data that we are collecting throughout participation. Maturation. Natural grief progression may reduce symptoms over time, independent of the intervention. Grief is its own process, so things could heal and it might have nothing to do with what we're doing here. Controlled pre and post assessments would help to track some of this progress. Attrition, emotional distress could lead to participant dropout, which would result in incomplete data, and dropouts may differ from those who complete the program. Testing effects, repeated use of assessments may lead to response familiarity, which sometimes we see where people just like click the same answer because that's what they've clicked in the past, or like that's what they feel is like the right or the most safe answer. Alternate versions where like maybe questions are just like the same idea but a little bit different in wording could help with this bias. Generalizability findings apply mainly to the population that we're seeing at Ohio Health of violent crime victims. And so that might not expand to all of Ohio or all of the United States. Differences in trauma recovery centers differ based on demographics, location, things like that. Trauma recovery centers are common throughout the United States, but again, they can differ in their uses and the way that they are taken it like used and taken advantage of by participants. It's a quasi-experimental approach with systemic data collection, mixed methods, and there is a lack of like randomized control group because it is such a specific population of people that are being targeted. Ethical considerations, informed consent. Participants, when we explain this to them, they need to understand what they're going to be getting into, and our goals throughout it. Confidentiality forms will need to be signed. It is voluntary and there is a right to withdraw. This is a sensitive topic. It can provoke a lot of distress within people. Clinicians are obviously highly trained, and will need to provide support and probably other referrals as well. Um, Potential barriers kind of we already touched on this a little bit, but stigma, reluctance to participate, there can be distress. So using appropriate language and fully explaining transparently like what this um, system is, offering flexible scheduling, um, collaborate so that there is not limitations in resources. So collaborating with universities, with the hospital, and with research teams for support. Um, Kind of already gone through data analysis a little bit, but there's the pre and post design with some of these scales for assessing grief and depression and anxiety. Descriptive statistics will summarize pre and post test scores. Paired t tests will assess significant changes in grief and PTSD. Size calculations will determine the magnitude of observed changes, and repeated measures will be used to assess trends. Um, Qualitative, again, the pre and post interviews will be transcribed and coded for key themes related to participants' experiences, benefits, and challenges. Themes will be identified through inductive approach, ensuring patterns of coping mechanisms and resilience in development. Data triangulation will enhance credibility of findings, um, integrating insights from multiple supports. Um, Again, we talk about data analysis and some of the threats to validity, including selection bias and attrition. Um, all right. Some of the things that I thought would be helpful to discuss from my literature review were just some of the information that I found regarding grief and why. Um, at my internship this year, this is the program that we have decided to start. And these are kind of some of the things that back why we believe that this is important and why we want to start this now. Um, yeah, so family dynamics, grief impacts family cohesion and support networks. Um, Participant feedback surveys can measure engagement and perceived programs. We can use different scales to enhance insight. Um, the variability in grief experiences makes standardization difficult. Cultural factors um, can influence this, and um, we want to ensure comprehensive and culturally sensitive evaluations. The goal is to address emotional, psychological, and social impacts of loss, and as well as help to reduce emotional distress and provide coping and adaptive strategies. Before I finish up, I just wanted to share a little bit about how the program has been going so far, as I don't have the data in this PowerPoint, just for confidentiality purposes. But we have started participating in long-term case management for 25 families at Grant, and we are in the process of implementing some pre-evaluation or pre-intervention scales, and then there are even a few cases where we are at the midpoint in providing interventions of how, or scales of how they think the intervention is going so far. Um, a lot of this has started with assertive outreach and even asking patients if they are interested. And overall, most patients who have lost someone to crime have been interested in receiving additional services, as it can be difficult to kind of get your foot in the door and even fully process what is going on with grief. Um, yeah, so that is kind of all I have regarding my project. Thank you all for listening. I appreciate it. Yeah, that's all.